tests that allow us to discriminate which embryos we should transfer. We will transfer only those ones which got normal chromosomes. We can check alterations on the genes, that is called PGT-A. That is a test for illnesses which are related to a mutation in a single gene. We can check other structural anomalies, or we can also check anomalies in the number of chromosomes. When do we suggest the lady to have a pre-implantation genetic test? The main reason to do this test is mother age. We advise to do this test on women over 38, women who've got implantation failure, repetitive miscarriage, ladies who have got a previous pregnancy with abnormal chromosomical factors, or when one of the members of the couple is a carrier of a chromosomical illness. We don't advise to do this kind of test on the young population. It's not advised to do it on women less than 35. We should consider on women in between 35 and 38, especially when they have a very high number of blastocysts, because it's a way to discriminate, to shorten the time till we do the transfer and get a healthy baby. For women on egg donation program, there's been a recent study where was included over 1,000 ladies, and they had exactly the same live birth rate as people who didn't have any pre-implantation genetic test. So we don't advise to do it on our egg donation program. When we advise a pre-implantation genetic test, we advise this kind of test as a new tool to discriminate which is the best embryo for embryo transfer. There's been a recent publication from the group of Richard Scott in the US, where they have checked over 400 ladies. All of them had an IVF cycle, cultured to blastocyst stage their embryos, and when they reached the blastocyst stage, they had a biopsy. And they had an embryo transfer before they knew the result of the genetics in these embryos. The live birth rate on ladies having a euploid embryo being transferred was 65%. On the other hand, for ladies who had aneuploid embryos being transferred, live birth rate was 0%, but they had clinical pregnancy rate 24%. All of them ended up having a clinical miscarriage. So this is one of the main advantages of having PGT tests. We cannot create euploid embryos, we cannot improve the efficacy of the therapy, but we can diminish in a very important way the percentage of miscarriage. We can diminish the timing to have a healthy baby, and another very important factor, we can perform single embryo transfer and we can avoid all the complications related with the multiple pregnancies. One of the questions that some of our patients ask is, once they have got the PGT test done, do they have to do any prenatal tests? Well, PGT test is a very early prenatal test, but it's that early that we just check the chromosomes on the blastocysts immediately before the embryo is transferred. We cannot predict whether there could be a new mutation during pregnancy, so I would advise that all these ladies should have all the normal screening for the first trimester on genetic abnormalities, exactly the same way as the population who's not been done in these PGT tests. Women who have followed IVF therapy and PGT tests afterwards should know that when you have a biopsy done on your embryo, you cannot have a fresh transfer. Once we have done the biopsy, we send these cells for the genetic study, and once we get the result, then we are ready for the transfer. Normally results can take 2-3 weeks to be ready, so we will have to do the embryo transfer on the cycle immediately after the IVF cycle. We can do it on a natural cycle if the woman has regular periods. On the other hand, she can also follow a substituted therapy. So she can choose the best timing for the transfer. She can even select the day of the week when she wants to have her embryo transfer, or in cases of irregular menses or cycle abnormalities, it's preferable to have transfer on a substituted therapy. When patients demand PGT tests, some of them are worried about which are the problems that could carry having these PGT tests on their embryos. The group of Richard score established very clearly there could be some harm on the embryo because they were doing, on the first time they were doing this biopsy on embryos on day 3, when the embryo did just have 8 blast tumors. We could get one of them for this study. They have seen that when you do the biopsy on day 3, there's some kind of harm on the embryo, and it diminishes the implantation rate by 19%. So we shouldn't do this kind of test on day 3. Nowadays, we always do the PGT test on the blastocyst stage. At this time, the embryo's got over 200 cells. We just get few cells, 5-8 cells from the trophoblast, which will be developing in the placenta in the future. So that's not a big harm for the embryo. Nowadays, we know that if you do select the correct number of cells and the correct timing, there's no impact at all on the implantation or the embryo quality. So we are on the safe way.